Treatment for hypovolemic shock includes a series of steps created to minimize the effects. These steps include providing airway maintenance and the administration of high-concentration oxygen, replenishing fluids, and controlling bleeding in a patient who has suffered traumatic injury. Shock is defined as a failure of the body's circulatory system to deliver sufficient blood and oxygen supply to the body tissue. The different types of shock include hypovolemic shock, cardiogenic shock, and neurogenic shock. Hypovolemic shock is a state of decreased blood volume due to traumatic injury, dehydration, or vomiting. Cardiogenic shock results from the inadequate pumping of the blood by the heart. It is caused by a heart attack, also known as myocardial infarction, or other cardiac-related illnesses. Neurogenic shock may develop from uncontrolled dilation of the blood vessels due to nerve paralysis, sepsis, or anaphylaxis. The signs and symptoms of shock are caused by the body's attempt to adequately perfuse the tissues. Signs and symptoms of shock may include increased pulse rate, cyanosis, shallow breathing, low blood pressure, and altered mental status. Before initiating treatment for this condition, gather the following equipment: an intravenous infusion set, IV fluids, dressings, and other equipment used for hemorrhage control, a stethoscope, a sphygmomanometer, a blanket, and oxygen. These icons represent the individual steps for treatment of hypovolemic shock. Pay special attention to them. Prior to performing the procedure, take and verbalize body substance isolation precautions and put on protective gloves and eye protection. Open airway and assess breathing. Perform manual cervical stabilization and open the airway. Assess the patient's respiratory rate. If ventilations are inadequate, ventilate the patient with high concentration oxygen using a BVM. If breathing is adequate, oxygenate the patient by using a non-rebreather mask set at 15 liters per minute. Note, CPR is indicated if there is no pulse. Control bleeding. Once you have encountered a trauma victim, carefully expose the injured site to determine whether the hemorrhage is external or internal. Control the external bleeding by following the steps of hemorrhage control. First, apply direct pressure to the bleeding site. Pressure can be applied with a sterile gauze pad or gloved hands pushing against the wound. If the dressing becomes saturated with blood, do not remove the blood-soaked dressing, as this will hinder the clotting process. Instead, continue to place more dressing on top of the soaked one. If direct pressure fails to control the extremity hemorrhage, apply pressure to the pressure point. If the direct pressure to the wound and pressure point compression fails to control an extremity hemorrhage, you may apply a hemostatic agent if available. If all other means of hemorrhage control fail, the last resort to control bleeding is to apply a tourniquet. After bleeding has been controlled, proceed to the next step. Elevate the patient's legs. While the patient is lying in the supine position, elevate the patient's legs. This is called the Trendelenburg position. When treating shock, one of the major concerns is the brain is not being adequately perfused. By elevating the patient's lower half, vital oxygen-rich blood is forced into the brain, preserving life. Initiate intravenous fluids. In hypovolemic shock, the major concern is blood loss. The reduction in blood lowers the patient's blood pressure. This is due to the volume of fluid in the circulatory system decreasing. Fluid is introduced into the system by initiating 2 large bore IVs, bringing the blood pressure back to an acceptable level of 90 millimeters of mercury. Most protocols allow for a maximum of 2 liters of fluid, such as lactated ringer or normal saline, to be administered. Apply PASG if approved. Always follow your local protocols for the use of pneumatic anti-shock garment. Use of PASG is indicated for pelvic injury, abdominal trauma, and for bleeding from the areas that can be covered with the PASG. Apply special consideration to pregnant and pediatric patients. Inflate only the leg sections of the PASG for these patients. Do not apply the PASG if the patient is in cardiogenic shock or has a chest injury where abnormal lung sounds are present. Apply splint if time allows. Apply a splint if the injured patient has a suspected joint or bone injury. However, keep in mind, splinting the injury is not a priority for shock treatment. Apply the splint when time allows or during transport. Apply a cervical collar to the patient if the patient has a spine injury. If multiple injuries are present, you can splint the entire body by securing the patient to a long spine board. Maintain normal body temperature. Treat the patient for hypothermia if necessary. Maintain the body temperature and cover the patient with a blanket. Transport the patient. Do not delay the transport of the patient. Perform the more detailed exams and care procedures during the transport. Monitor and check the vital signs every 5 minutes. Anxiety and fear can increase the patient's heart rate and worsen their condition. If necessary, reduce the patient's anxiety by speaking calmly and reassuringly during transport.